when we look at frozen shoulder and we take them into external rotation, and you know they're limited in external rotation,
yes,
you can see why that bit of tissue there, when it stiffens up and thickens, would prevent that movement. You can see it extend there, can't you? And as it comes back, it slackens off and then extends. So the coracohumeral ligament is that bit of the capsule that we want to affect change when we're doing the shockwave. So part of the protocol of shockwave for frozen shoulder is anterior capsule for half the treatment and posterior capsule for the other half. So that's where I get my pen out. I can see that my transducer's got a little arrow in the middle. So if I get that right in the middle of the screen, I do a rather crude arrow and try not to get gel around it. And I can come in from the side. Not good with that in my mouth on TV, is it? That coming in there, that coming in there, and in effect, the TV camera can now see roughly what I've done there. So I can then draw a line. When he's lying on his back in a minute, I can know that that point there is the point where I need to put either the focused or the radial. Does that make sense?
Yep.
If I put that back up. I think I was just about to say, because we're sort of doing a bit, you let your arm rest a bit, because it's a bit annoying holding that there, isn't it? And then pick it up again. Perfect.
Oh, that was a lovely rest.
So we've looked at subscapularis, and there's a little bit, so we can see these age, slightly, if you don't mind me saying, age-related changes. So we've got these little bits here, which are just where the tendon is pulled away a little bit from the bone. And then if we look at his supraspinatus and his hand on his back, and the supraspinatus comes from, the supraspinous fossa, comes round the shoulder in this direction, which is the bit that everyone gets confused. So this is a modified crass. So we do this position to treat as well. In some situations where we want to affect change to the calcific tendon. So we can see on here, that's his supraspinatus, this grey beak-looking thing.
Okay.
So his greater tuberosity is this little bit here. So if we can blow that up, we can get a good look at actually his rather healthy looking supraspinatus. It's healthy, we know, because it's really uniformly grey. We call it homogeneous. Right. So an homogeneous look on ultrasound is great. We've got the bursa over the top, which is him, nothing too bad, and then we've got deltoid over the top of that still.
So the bursa again there is...
The bursa is almost unidentifiable. If I can pick it up, it's that slightly white bit over the top.
Yeah. Okay.
And when
if there was a bursitis, that would be much thicker, bright white.
Thicker and black actually, because if it's filled with fluid, black is fluid on an ultrasound. So that would show up, and then we'd also then look at putting a Doppler on it, which would show us lots of vascular activity in the bursa if it's a bursitis.
Right.
Yeah. Okay. But we haven't got any issue with this.
Well, John will be very pleased to hear that part of him is healthy, at least.